Hey, podcast friends. This is Dr. Steve Hewlett with the podcast Simple Healthy Choices for Weight Loss, where every week we help people who have realized that as their health has been declining over the years, the number of medications they are being prescribed is increasing. We realize that even though the path to better health and a medication-free life may be very simple, it definitely is not easy. We truly want to help you change your habits and change your thoughts about what true health nutrition is. And now we can. We are so excited to provide you our new online Thrive Naturally Transformation course. This course is complete with 10 to 15 minute videos that will not only walk you through changing your home and mental environment, but also teach you how exactly different foods we put in our mouths can have devastatingly horrible effects on the body and how some have great healing ability. If you'd like to enroll in our new Thrive Naturally Transformation course, please go to our website, drstevehewlett.com, and click on the Work With Us tab at the top of the page. We truly are here to help you get off medications and start living the vibrant, pain-free life that you would love to live. Hey, welcome back again, podcast friends. Now, in this episode, first I want to apologize because I wasn't aware until I started getting questions. And a lot of my past podcasts, I've always brought up this term called metabolic syndrome. And I never really thought about the fact that I never actually explained what metabolic syndrome was. So that's what this podcast is just kind of explaining a term that I've been using all along. And basically, the whole thing is metabolic health. What metabolic health means is that you're giving your body the proper nutrients, all the nutrients. You're eating the proper nutrients and drinking the proper nutrients that gives your body all the stuff that it needs for fuel, for growth, for repair, and to be able to store energy. And that's everything. That means we are healthy because we're giving our body the nutrients that our body needs to be able to take care of itself. So again, what are these nutrients that our body has to have? It cannot make it on your own. We have to eat it. That's amino acids, which that's the basic building block of protein. So you have to eat protein. Fatty acids, which is the basic building block of fat with cholesterol. So you have to eat fat. Fat is very good for you. Do not be thrown by the lies that we've been told all along from the food companies talking about eating the low fat, high carb diet. That's what's gotten us in this place in the first place, is believing all those lies. And you can listen to my last podcast if you didn't listen to that to know what I'm talking about. But so we need amino acids, fatty acids, vitamins, minerals, and water. Okay, that's what our body needs. If we give them those things, if we give our bodies those, they can take care of all the functions that it needs to be able to, as we said, grow, heal, thrive, and survive. Okay, and that's what you want. You want to give your body nutrients. However, okay, we nowadays have extremely poor metabolic health, meaning we are not giving our bodies the nutrients that it needs to grow, heal, thrive, and survive. What we're doing instead is we're feeding it toxins that make us become diseased. And you'll know if you have poor metabolic health, meaning you are not eating what your body needs and you're actually eating what is toxic to your body. You'll know this because you're going to have things like type 2 diabetes. Perfect example of eating the wrong things. So type 2 diabetes, high blood pressure. If you have high blood pressure, basically you do have insulin resistance. And whether you have type 2 diabetes now or not, doesn't matter. You will be getting it. And just by hiding the symptoms of blood pressure, by putting all these different blood pressure medications that work in all these different ways and never treat the underlying cause, you are never going to cure anything. Medications do not cure anything for the most part. If you're talking about antibiotics or something like that, that may cure. But most medications are only there to treat symptoms. Okay. That's how the drug companies make money. That's how the hospitals make money. That's how the whole medical system makes money. is if you keep treating the symptoms and never treat the underlying cause, then you can keep adding more and more medications that have more adverse effects. You can add more medications and you make a lot of money for your shareholders. And the way to do that is keep eating the kind of food that the food companies are giving you, because that's what's making you sick and that's what's needing medications. So they make lots of money while you get sicker and sicker. So besides this, so you have type 2 diabetes, high blood pressure, obesity, heart disease, cancer, fatty liver disease, gallstones, PCOS. PCOS is polycystic ovarian syndrome. This is one of the most common reasons why women can't get pregnant today, especially our younger women. And this is directly related to high insulin levels. Keeping your insulin levels high long periods of time cause you to have cysts on your ovaries so you cannot produce the eggs. And besides that, keeping your insulin levels high also causes erectile dysfunction. So there's two big reasons, one on the female side, one on the male side, both caused by the types of food that you eat that keeps your insulin levels high. And that's why you can't get pregnant. Okay. This is huge. This is a big, big thing. And this is not irreversible. This is extremely reversible. If you just start eating right and keep your insulin levels low, this can be reversed. PCOS can be reversed. Obviously, erectile dysfunction can be reversed. Gout can be reversed. Type 2 diabetes can be reversed. High blood pressure can be reversed. You can reverse all this, get off all the medications that you are being treated for these things if you just give your body the nutrients that it needs. Okay. I know that sounds weird and it's almost hard to believe, but please believe me, I do know what I'm talking about. And I'm not the only one talking about this. There is information all over the place that talks about this. The only place you're not going to find this information is in the medical system. Nobody in the medical system is going to tell you how to prevent disease, because that's how they make their living. Obviously, the food companies, drug companies, and all them, they're not going to be telling you anything because they're making the money off that also. So besides those I talked about, the PCOS, erectile dysfunction, obstructive sleep apnea, if you're having trouble with sleep apnea and you're on some kind of a CPAP machine, get your nutrition right. Stay away from carbohydrates and eat the kind of food that keeps your insulin levels low, which is protein and fat. Please stick to that, get away from the carbohydrates, and you can also get rid of your obstructive sleep apnea, gout, Alzheimer's. I mean, the list goes on and on. And there is a reason for this. This isn't like some, I don't know, voodoo or something, that says, oh, I want people to eat right, and so that's going to cure your every ail. But it is true. It is almost definitely true. Everything functions better if you give it what it needs to work. Okay. And our bodies are the exact same way. So metabolic health means that you're giving your body nutrition instead of poison. Metabolic unhealth or poor metabolic health, that means you're giving your body poison, which is carbohydrates, and all man-made products, because all man-made products are made out of ultra-processed seeds and grains, which are very toxic to your body. Also, they're all made out of sugar and high fructose corn syrup to keep you starving to death, keep you addicted, keep you coming back for more, and vegetable and seed oils, which are highly toxic, highly inflammatory to your body. And all man-made food, everything in box, bottle, can, is made of that stuff. So that's what you have to stay away from. Okay. And it is so strange that the term metabolic health or metabolic syndrome, this wasn't even a term until after our dietary guidelines came out in 1977. Once our new dietary guidelines came out that started making everybody sick, everybody killing everybody, making them because they're telling everybody that fat is bad and carbs are good. And it's the exact opposite. It is the exact opposite. And that's why we're seeing all the diseases we are now. In fact, it is proven, it is fact that an extremely high percentage of patients who are obese, they end up with type 2 diabetes. And then an extremely high percentage of patients that have type 2 diabetes end up with metabolic syndrome. Metabolic syndrome wasn't even a term. This was actually coined by Herman Holler back in 1977 when we first started seeing this metabolic syndrome. And then in 1988, Gerald Reaven, he was seeing this also, and he used the term syndrome X. And all that is insulin resistance. They didn't know about insulin resistance back then, but they noticed about all these other conditions. But now we know syndrome X is insulin resistance. How do you get insulin resistance? The way you get insulin resistance is keeping your insulin levels too high for too long. And when we say long, I'm just not talking a day, a week, a month, or even a year. I mean, you could be keeping your insulin levels high for 10, 20, 30 years before you actually start seeing the problem of high blood glucose. So just because you don't have a high blood glucose does not mean that you are not insulin resistant, okay? You are working on insulin resistance anytime you keep your insulin levels high. The way you do that is keep your blood glucose high, because that's what causes your body to release the insulin to make it high. So how does your blood glucose get high? There's only one way. There's only one way your blood glucose goes high. That's because you eat carbohydrates that have the basic building block of glucose. And the more you eat those, the more you keep your insulin levels high. So if you're eating them all through the day, like most people do, remember, a carbohydrate means anything that's plant-based. If it did not come from an animal, it is a carbohydrate. Basically, that's just, in simple terms, that's a way you can look at it. So when you eat plant-based foods and your body breaks it down to glucose, puts glucose in your blood glucose goes up, so does your insulin. Now you end up with, after 10, 20, 30 years, now you end up with insulin resistance. And now you have insulin resistance, so now your blood glucose goes up, okay? None of this really started until after our dietary guidelines came out in 77. That's when everything started happening. So remember the three pillars of disease, the three things that cause almost every disease that you can think of. And I can tell you to the molecular level why this happens. And I have in past podcasts. I won't be on this one. However, I will give you several podcasts throughout this one to refer you back so you can understand this even more. But just remember that the three pillars of disease are high insulin levels, high inflammation, and high blood glucose. When you have those three things, mainly high insulin and inflammation, the blood glucose just comes because of what happens with your insulin and insulin resistance. But once you have those three things, now you are actually starting to rot every single organ in your body, because you're giving it nothing but high insulin and glucose and inflammation when it's asking for amino acids, fatty acids, vitamins, and minerals. Okay. You see the difference of what we are doing and what we're actually being told to do this by the medical community, who keeps telling us that we need to eat by the dietary guidelines, by the food pyramid, the absolutely worst thing that's ever been constructed. No scientific background. That was a marketing ploy put on by the sugar industry to help the food industry get more people to eat their food, which they did. And now we are sick because of it. So that's what it is. So what is metabolic syndrome? That's why you tuned in. Metabolic syndrome. Metabolic syndrome is when you have any three of these following five things. Okay, any three of these. If you have high blood pressure, if you have high fasting blood sugar, if you have high triglycerides, if you have low HDLs, which is the good cholesterol, or if you have increased abdominal obesity, you have a lot of fat around your midsection. If you have any of these five things, okay, any three of these five things, you are considered to have metabolic syndrome, okay? That means you have insulin resistance. That means you are getting ready to kill almost every organ in your body if you haven't already started on it. But you have already started on it, I guarantee it. Especially if you have a fatty liver disease, that means you are storing fat around your body. And you can tell that by the abdominal girth, and we'll talk about that. So what I want to do now is just let you realize, if you have any three of those five things, again, it's high blood pressure, high fasting blood glucose, high triglycerides, low HDLs, or high abdominal obesity. If you have any three of those, this is when you're going to come up with, it's the base of all these diseases. Okay. And if you want to know exactly why, if you want to understand why, go back to episode number 8. Episode 8 is called How Excessive Carbohydrate Intake Causes Organ Failure. And I will explain it there. But what kind of organ failure are we talking about? When you have 3 of these 5 things, we're talking about they see a huge incidence in fatty liver disease, fatty pancreas, pancreatitis, different cardiovascular diseases like heart attack, congestive heart failure, aortic aneurysms. And I just talked about a book in my last 2 podcasts called Stay Off My Operating Table by Dr. Philip Ovadia. And that's what he does. He's noticed all these patients, young patients, not necessarily obese. He's even seen some thin ones. And I've talked about that in the past podcast. But all these patients are starting to come in with fat all around their heart. And that's what he has to go in and he has to try to deal with. But now he's learned how to get that fat back off your heart. And it is not by surgery. It is by what you eat. He's learned that. He's living it. He's changed his nutrition. He's changed his health. And he wrote a book just like I did because we want everybody to understand what we're learning and that we've been lied to for so long. So even aortic aneurysms are also caused by this exact same thing: high insulin level, inflammation, and high blood glucose. That's what's causing this. Atherosclerosis, which is hardening of the arteries, strokes, peripheral vascular disease, amputations of your feet, your legs, kidney disease. Type 2 diabetes is the number 1 cause for patients to go on dialysis. And that's for the same reason we're talking about: high insulin, high sugar, and inflammation. That's also the reason for cancer, blindness, Alzheimer's disease, infections, skin and nail infections. I used to have eczema all over my arms, all over my elbows. I had it on my knees. I had bumps all over the back of my arms. I've had this for my whole life. So I'm 62. I just found out about clean eating about 10 years ago, actually about 5 years ago. And since I've started eating this way, my eczema is gone. I have no more bumps on my arms. I have no eczema, no psoriasis, nothing on my elbows, knees. You'd be amazed at all the things that clear up when you start eating appropriately. If you have anything like infections, skin and nail infections, erectile dysfunction we talked about, and PCOS, polycystic ovarian syndrome, these are all diseases that are caused by the same thing and can be stopped and reversed unless you've gone too far, such as the amputations. But if you haven't, you can, and there's never too late. Never, ever, ever is there time too late to start eating healthy and quit eating toxins. Never. Okay. Even if you're getting chemotherapy for cancer, if you could avoid carbohydrates and stick to real meat, okay, real meat, a lot of times you can get rid of a lot of your cancers also. And this has been proven over and over again. You can look it up in the literature. Okay. But what is crazy is if you are on dialysis, okay, caused by having high insulin levels, caused by eating carbohydrates all the time, or if you have cancer, which also a lot of cancers are also caused by the same thing: inflammation, the chemicals we put in our body, and the high insulin levels and high glucose. Okay. Cancer feeds off glucose. Even if you have those, if you go into the hospital today, because I know people have done this, while they're sitting there getting dialysis or while they're getting their chemo treatments, you see tables all over the place full of nice little treats, nice little brownies, cookies, cupcakes, things to help their little patients because they're going through dialysis and chemotherapy. They don't even realize, the medical system doesn't even realize that it's those cakes, those candies, those cookies, those ultra-processed man-made toxic crap that got you there in the first place. And that's how you know that they know that they don't know that, because they're serving it to you while you're actually getting your treatments. It's ludicrous. It's absolutely ludicrous what goes on. But the medical field is not taught anything about nutrition in medical school or when they get out. I was never taught this either. Okay. You have to look for it on your own. Once we find that, once the medical professions who found how important nutrition is to actually taking care of our diseases and prevent them from the first place, that's why a lot of us are dropping out of the medical field, writing books, doing podcasts, giving talks, doing everything we can to let other people know that the way our medical system is set up right now, it is not for your health. Okay. It is money. And so I want to break each one of these down real quick. Metabolic syndrome. Okay. The first one we said is high blood pressure. High blood pressure means if you have a high blood pressure of greater than 130 for systolic or greater than 85 diastolic. Okay. If you have high blood pressure, that is one of the links in this. Or if you're taking medications for high blood pressure, because you can't say you don't have high blood pressure, but you're taking medication to keep your blood pressure down. Okay. So if you're taking medication for high blood pressure, you have high blood pressure. Okay. The second one, high fasting blood sugar. Oh, and as far as high blood pressure, if you go back to episode number 12, I actually talked about how carbohydrates cause high blood pressure. So it explains exactly why this happens. High fasting blood sugar. That means that you go in for a high fasting blood sugar that you've waited at least 6 hours and preferably around 12 hours before you put any carbs in your mouth. Then you test what your blood sugar is. If that sugar is higher than 100 milligrams per deciliter, then you're considered to have a high fasting blood glucose. Or if you're taking medications for diabetes, for blood pressure, for diabetes, if you're taking medications for that, then you've got to say, yes, you also have high fasting blood sugar. You do have either pre-diabetes or diabetes. Okay. So if you're taking medications, that automatically makes you have one of those criteria. The third criteria was high triglycerides. Okay. High triglycerides means that you have greater than 150 milligrams per deciliter, or you're taking medication for high triglycerides. And this is a perfect example of absolute ludicrous information that we get. Because if you get a high triglyceride, I would love to know your answers to this. How many times you go in for high triglycerides and the physician tells you, oh, the reason you have high triglycerides is because you eat too many carbohydrates, because carbohydrates get turned into triglycerides. If you want to decrease your triglycerides, decrease the amount of carbohydrates that you take. And carbohydrates means all food that doesn't come from an animal. Okay? Doctors don't tell people that. They say, oh, you have high triglycerides. I need to give you a medication. Oh, you're on that medication? Let me give you a different medication. They never tell you what caused the high triglycerides, just like they never told you what caused the high fasting blood sugar, which is insulin resistance, because you keep insulin too high, too long, because of the carbohydrates. They don't tell you that this is how we can reverse your high blood pressure. We can make it where you don't have high blood pressure anymore by changing what you eat. No. They're going to put you on medications. There's all kinds of different medications for blood pressure. They work all different ways. So if one doesn't work, just add another one. If that doesn't work, add another one. If you get an adverse effect from one of those, that's fine. We have drugs for that also. That's the way our medical system is. We're set up. We're set up for that. The doctors are set up for that. They're not allowed any time for any patients. They're not explained anything about nutrition. They aren't explained anything in medical, how to prevent and reverse diseases. All they're taught is how to treat them. What medications do you need to use in what situation? So we talked about high blood pressure, talked about high fasting blood sugar, talked about high triglycerides caused by carbohydrates. If you have triglycerides, you don't need the medication. You need to stop the carbohydrates or use the medication until you can stop the carbohydrates, and then you get off the medication. The fourth one is high HDLs. This one really confused everybody because HDLs, which is your good cholesterol, that's produced in the gut, okay? And the way you increase your HDLs is by eating fat, okay? That's a known thing. High HDLs, the good cholesterol, and low triglycerides, okay? That is how you get when you eat healthy fat and avoid carbs, okay? The healthy fat gives you high HDLs, which is good. That's your good cholesterol. And avoiding the carbs keeps your triglycerides low. And those are the two main things that cause metabolic syndrome. Remember, high triglycerides and low HDLs. That's how you get it when you avoid fat or you eat low fat and you eat high carb. That's how you get high triglycerides. That's how you get low HDLs, by eating per the dietary guidelines, eating per the food pyramid. That is absolutely horrible. So high blood pressure caused by what you eat. High fasting blood sugar caused by what you eat. High triglycerides caused by what you eat. Low HDL is caused by what you eat and what you don't eat. Okay. So this is extremely important. That's why this is no little thing. Please realize what you put in your mouth is so important. I really want you to understand this. I have been a doctor of pharmacy for almost 35 years, and I'm here to tell you, I want to get you off of medications. All medications have multiple adverse effects. And don't worry, because if you have an adverse effect, there's another medication for that. And when you add more and more medications and all their adverse effects, you're just increasing the adverse effects. Okay. This is no little thing. I quit my job because of this. I retired early because of this, because I could no longer go in and tell people how to manipulate their medications when I know the answer. I know the answer of how to get them off of it. And it's teach them about nutrition. Teach them stay away from carbohydrates. That's what I'm trying to teach everybody. If you just listen, I know it's hard because you're listening to drug companies and food companies and sugar companies and ag companies and chemical companies that are all telling you the exact opposite thing to do, and the insurance companies and the medical companies. They're all telling you the exact opposite. I understand why you'd be confused. That's why I want you to listen to these things. Just like for the high fasting blood sugar, there's two podcasts that I talked about for that. One of them is podcast 47, What Exactly is Insulin? And number 98, What is Insulin Resistance? Then for the high triglycerides, I tell you exactly how high triglycerides are caused by what you eat. And that's by episode number 110. Why does eating too many carbohydrates cause heart attacks? Okay, so go back and listen to those. Then as far as the low HDLs, remember, this is the other thing, low HDLs. This confused people because HDLs, they're calling that your cholesterol. So there's good cholesterol and bad cholesterol. But wait a minute. If they're saying that high cholesterol is bad and causes cardiovascular disease, but they're saying high HDL cholesterol is good, that doesn't make any sense. High HDLs are good, even though that's a cholesterol, but high LDLs are bad, and that's the exact same cholesterol in both of them. It's not a different cholesterol, okay? It doesn't make sense because it's not cholesterol. We've known this forever. It is not high LDLs that cause cardiovascular disease. That is a scheme by the drug companies to sell statins. That's all that is, okay? High LDLs. Did you notice when I read about the 5 things for metabolic syndrome? High LDLs is not even listed, okay? It's high blood pressure, high fasting blood glucose, high triglycerides, low HDLs, and increased abdominal obesity. LDLs are not on there because LDLs do not have anything to do with heart problems, with heart attacks, okay? Again, they're just trying to sell you statins, and they're doing a great job of it. Now, I hear there are physicians who are telling people that even if you don't have high LDLs, we think you need to be on a statin because chances are you're going to get high LDLs, okay? Because you're still eating the same way you do, but they don't tell you that part, okay? So this is all a money-making scheme for the drug companies. Statins are toxic, okay? Now, low HDLs. Now, when we say low HDL, okay, first, high triglycerides, we're saying if it's greater than 150. Low HDLs, if their HDL level is less than 40, or for women, if their HDL level is less than 50, that's considered low HDLs, okay? So that would be another one. How do you increase HDLs? You eat fat. That's the only thing that they found. So you eat fat and you decrease carbs, which is the exact opposite of what they're telling you in the dietary guidelines, okay? But HDLs increase by fat intake, triglycerides get decreased by decreasing carbohydrates. Okay, now let's look at the increased abdominal obesity. What does this mean? Increased abdominal obesity means that you are storing fat around your internal organs. Basically, that's what that's indicative of. So if you take and you measure your stomach, your waist, up around the level of your belly button, just a little bit above the belly button, not down around your waist. You cannot use your pants waist size. Measure at the biggest part of your abdomen. If that amount is less than half your height, that's good. If it is more than half your height, okay, so let's say you're 5'8", okay? So you're 5'8", that's 68 inches tall. Half of 68 is 34 inches. So if you're 5'8" and you measure around the widest part of your belly and you're higher than 34 inches, that's indicative that you are storing fat around your internal organs, and that is where all the diseases start coming from. That's how you end up on the operating tables, by storing fat. The reason you're storing fat, I've alluded to that, I've talked about that in past podcasts, but when you store fat and your fat cells can't hold it anymore because you continue to eat carbohydrates and that get turned into fat, and you keep your insulin levels high that continue to make you stuff fat, the fat starts leaking out of those fat cells and starts storing around your organs in the first place. So again, if you can start using your body to use fat for its energy source and quit telling it to use glucose for the energy source, you could clear all of this up. And that's exactly what I want for everybody. So that's what you want to do. If you keep your insulin levels low, because you don't eat carbohydrates, so you're not putting glucose in your blood, you keep your insulin levels low, fat doesn't increase your insulin levels at all, and protein does just a tiny bit. Keeping them low, that forces you to eat the fat out of your fat cells and also off of your organs. So you really can reverse almost every one of these diseases that we've talked about, as long as it hasn't gone too far. And there have been a lot of people who have not been able to get pregnant because of the PCOS or erectile dysfunction that's changed what they ate, and now they can get pregnant again. So please don't think this any little thing. This is huge. There have been cancers that have been reversed. There have been a lot of things that have been reversed, definitely type 2 diabetes, just by changing what you eat. So as far as, remember, high LDLs, that is not a thing. It's not even on the metabolic syndrome criteria. And I talked about this in episode 113. Does high cholesterol cause heart attacks? So if you want to know more, you can go back to that. And also my last one, episode 68, what are the most common adverse drug reactions with statins? Please go back and look at that. I explain exactly how statins work and how they actually starve your cells to kill your cells one cell at a time. And so go back. That's episode 68 if you want to hear about that. But just remember that our treatment guidelines, our medical treatment guidelines, they are formed by the drug companies who do all these studies. Even if they're manipulated, lied, cheated, everything in the studies, they're the ones who come up with the treatment guidelines. So before they can get paid, the doctors are going to have to prescribe per the treatment guidelines. And the treatment guidelines are there to help the pharmaceutical companies and all these other companies make lots of money. So please don't fall for it. Change your nutrition and see how great you can do. And if you've got the starting of any of these conditions, you watch. It won't take very long for you to actually, once you start eating right, watch your carbohydrates or decrease them. Only eat real animal meat, real animal fat, real fruits, and real vegetables, and stay away from all the man-made food. And I guarantee you are going to feel much, much better for it. So if you have any three of high blood pressure, high fasting blood glucose, high triglycerides, low HDLs, or increased abdominal obesity, any three of those, you better be careful. These are the warning signs, and it's time to change what you eat if you don't want those to progress anymore, and if you don't want to be put on any more medications with all their adverse effects. So anyway, that's all I have for now. That's what metabolic syndrome is. And thank you so much again for listening. Have a wonderful week. And as always, make simple, healthy choices to live a quality life. If you enjoyed this podcast, please hit the subscribe button below and be sure to tell someone else who may want to change their health path as well. And remember, if you would like to enroll in our new online Thrive Naturally Transformation course to help you reach your new improved health goal, to reverse type 2 diabetes, feel great, and get off medications, we are here to help. Just go to our website, drstevehewlett.com, and click on the Work With Us tab at the top of the page. We truly are here to help you get off medications and start living the vibrant, pain-free life that you would love to live.